replacing oat cells and producing new cells to meet growth needs. So when a malignancy happens, it's when this balance is unable to be maintained. Okay? So neoplasms are the leading cause of death among children under 15 years old. And neoplasms could be either benign or malignant. Okay, with our malignant, that means uncontrolled growth. There's no balance between the old and the new cells. Okay? Okay, so when we take a look here at this diagram, look at acute lymphocytic leukemia. That accounts for 32% of all childhood cancers. So when we're doing an assessment of a child that we think may have a malignancy, so what is some of the things that we do? We get a family history of the child. What have they seen? What are some signs and symptoms that they have seen at home? Is there any family history of any cancers? So if you look over there at box 53.3, you can kind of see how vague these signs and symptoms are. Unexplained weight loss, fever, fatigue, pain, skin changes. So just looking at those general symptoms that you could have, well, when you have a virus, you have unexplained weight loss, you might have fever, you might be really tired, you might be hurting. So sometimes it's hard to decipher. And a lot of times you'll hear parents say, like, well, I've seen these, but I didn't think that it would be something serious, and I wish I would have came in sooner, and they tend to blame themselves, and we have to be their support person for that, and help find referrals out there and support groups to help them get through this episode in life, because they're going to grieve. The parents are going to grieve of the thought of having this healthy child and what your plans are, or what their plans are for the future of this child. So we do a physical. They'll do some labs. If they do suspect that something may be malignant or has a risk of being malignant, then they will do a biopsy. And that's basically, they're just surgically removing tissue, cells, and they're going to analyze them. This is usually used to confirm a diagnosis. With your leukemia, they would do a bone marrow aspiration and biopsy. So then they do the biopsy, yes, it comes back malignant, and then they will stage it. And what staging does, it just helps them to label it, so you will know the extent of the tumor, how it will progress, and then it will help make a treatment plan individualized for that patient. So, for example, somebody with a stage 1 cancer is not going to have an as aggressive treatment as someone with stage 4. So let's talk about treatment of cancers. So the first one I want to talk about is chemotherapy. And so there are different types, lots of types of chemotherapy out there. Even if you look here at the types, antibiotics can be a form of chemotherapy. So what is the goal of chemotherapy or of radiation, which we'll talk about here in a little bit? And the goal is to decrease the tumor size and then determine if they need to do surgery from there, or what exactly their plan is. So chemotherapy destroys malignant cells. Now we talked earlier how malignant cells are very rapid growing cells. So the issue with chemotherapy is it sees, okay, here's our abnormal cell, or here's our abnormal cell, and here's a normal cell. but they're both fast-growing cells. Well, chemotherapy does not go in and say, okay, this is an abnormal cell, we're going to kill it. Oh, this is a normal fast-growing cell, we're going to keep it. Nope, it goes in and says, yep, gone, yep, gone. And so whenever it does that, that's the reason why we see alopecia with chemotherapy patients. So alopecia is hair loss, and that's because hair is fast-growing cells, okay? And so that's why we see that. Some other things that we see at chemo is ulcers in their mouth. We can see skin breakdown, neuropathy. So think about when your foot falls asleep and then you step on it and it's like you're stepping on pins and needles. That's what neuropathy feels like. So they can get that from chemotherapy. Loss of appetite. So nutrition is going to be big with these kids. So if you look on page 437, 438, you can see some more side effects of chemo. So remember that we're going to be taking a holistic approach. We're going to want somebody to come in and, nutritionalists discussing how we can give optimal nutrition to this child. We're going to want to focus on body image, especially if we have an adolescent and they're losing their hair, on ways to make them feel more comfortable with themselves. So radiation. So how does radiation differ from chemotherapy? Well, radiation, we are radiating a certain area. So depending on what we're radiating, depends on what effects we're going to see from radiation. So, example, if we were radiating the bone, then we may see like asymmetrical growth in our bones. They're going to be at risk for fractures. So it really depends what area we're radiating. Again, radiation affects rapidly growing cells. So the big things that we need to teach is we do not wash out the radiation marks. We don't place lotions or creams on those areas, okay? Unless it's something the doctor prescribed to them. During treatment, we reassure the child caregiver sedatives will be given for comfort. For radiation, it can be painful, and sometimes you as the nurse will be responsible for coming up with distractions and stuff for the child, so they don't think about what's going on. Also, we talked in previous lectures about child life in hospitals, so they would be a great resource for them to come up and do some play therapy and do some distraction techniques to help keep these children comfortable during the procedures. So, with radiation and chemotherapy, it's usually done in more than one treatment. The reason why is we want to ensure that we're treating in an optimal timing, okay? And because I say that cells are in different stages of cell growth, and some treatments work better at different stages of cell growth. So we want to make sure that we're hitting that optimal cell growth stage to kill those cells. So we're going to watch a quick video.
Is different. It's changed for me. And
I go home like for a week or a couple of days, and I come back, and then that's when chemo starts for me. It depends on what the chemo is. It lasts probably lasts months, sometimes 5. Chemo lasts 10 days, 7 or 5. And the time right now, it was 7 days for me to get the chemo. And then the chemo wiped out my whole immune system. Those are the things that's called counts. And that's, if you don't have it, counts or cells, that's what they are, you can get sick easily. So you gotta be careful, like what do you do or about people you around.
Well, when I got chemotherapy, they gave me a lot of medicines that were anti-nausea, and they kind of put me to sleep when I had it. So when I was actually getting the chemotherapy, I was asleep, so I didn't feel nauseous. But a lot of times, I get like in around like for a week, and for about that whole week and a couple days after when I was getting it, I feel pretty sick, and I couldn't really do anything, so I just had to like lay down on the couch and feel pretty bad.
When my hair fell out, it was dyed. I dyed it pink and green. And they always say that it's fun to try and make it crazy because it's just going to fall out. So however you want it to look, then it's different. But then it just comes out. For every person, it changes how it comes out. Some people, it can come out fast, others slow. Some you'll wake up with half your hair gone, and others, it depends. But it changes.
When I first lost my hair, I wasn't really mentally prepared for it to happen, so it was a little scary for me, but afterwards it wasn't that big of a deal. And when it first started happening, it was kind of slow, but then over the course of the week, it got faster and faster, and by then it was all gone.
When I first started losing my hair, I was really scared and nervous because I didn't know what I would look like bald or losing hair in general, but then I got a wig and I started wearing that, and then the wigs are more better than normal hair, I think, because like you can do whatever you want with it.
When I first lost it, I wore a hat to school because it was just really new to me and I was a little self-conscious about it. But then after a while, my head was really sensitive when I first lost it, and so I decided to just go without the hat, and my friends ended up being perfectly fine with it, so it was okay.
I have my port in December. It's to receive chemo and draw blood.
They look up the lines right here, and you have to pull the machine around like everywhere you go. And it's like when I first had to pull the machine around, I feel comfortable with it. And then you start to get used to it, and I go out more with the machine than I did before. And like when you want to hold your lines when you pull the machine with the machine, so you won't pull on the lines because you flip it up to right here and you pull it, mess up the dressing, and it kind of hurts a little bit.
Before I got my port, I was very anxious and scared because I didn't know what they were putting inside of me, what was going to happen. And after I woke up and realized what it was, like, I was more comfortable with it after they told me like what was going on and how they were going to perform it, or every time I got my chemo. With the port, you can swim, you can take showers, and you really don't feel that it's there. Like, when you first get it, you're just like, oh, I have a port, but then you get used to it.